I'm Carol Campbell Edwards. I'm a licensed clinical social worker, and I am an assistant teaching professor in the FSU College of Social Work. I also am really honored to be the president of NASW Florida.
And I'm Marianna Tutwiler, and I'm the program director at the Florida Institute for Child Welfare, which is housed here at Florida State University College of Social Work. And what we would like to talk to you about today is our joint venture between the two of us to establish a child welfare track at the NASW conference for 2019.
Well, good afternoon. Carol, we're going to start with you. Can you tell me more about the National Association of Social Workers and the annual conference?
Absolutely. Well, NASW started in 1955. It's the largest member organization for social workers in our country, and we are just delighted to be the provider for many social work CEs, which are our continuing education units. So for licensed social workers, they really seek NASW for those services. We also have a legal team. NASW also has a very strong partnership with graduates out of social work programs. We look for job placement is one of our big efforts that we do. But education is probably one of the areas that we invest in most. And so our annual conference is a real opportunity for us to partner with other organizations and to really mobilize social workers throughout Florida and getting everyone engaged in current research, best practices. So we look at things at the conference from a micro and a macro level. And we have been doing this conference in Florida for many, many years. And we're very excited about our 2019 conference and our partnership with the Institute for Child Welfare.
Wonderful. And as the new president, what are your goals for the NASW?
Well, I'm so glad you asked. When I made my first comments to the group at our last conference, I had just become the president for NASW. And so I laid out my goals. And I have 4 key goals. The first goal that I'm very committed to is increasing our student involvement. So as a faculty member, I know that students bring a new sense of energy. They're innovative in their thinking and ideas, and we really need that in NASW. We've been around for a long time, and there's always that need to rejuvenate and do some rebranding. So student involvement and new social work involvement at every age is really important. Secondly, we want to really increase our collaboration with our schools and colleges of social work throughout Florida who do amazing research and teaching in social work education. So we want to really strengthen those partnerships. A third goal is to really look at strengthening our annual conference. So our conference, as I said, has been pretty much following a similar operational track for a long time. And so we want to re-energize it, and we want to engage our social work and partner populations that may not have been engaged before. So we'll talk a little bit more about that. And then my last goal was to increase our diversity and inclusion initiative to really make sure that we are practicing those standards that are outlined in our code of ethics around diversity and inclusion and really embrace and celebrate those areas. So those are my 4 goals.
That's great. And in terms of your collaboration, you had said that you're working with the Institute. So Marianna, can you tell me why the Florida Institute for Child Welfare wants to sponsor a child welfare focused track at NASW?
Yes, there's several reasons. One is personal. I'm a member of NASW, but when I went to previous conferences, they didn't have anything for child welfare or for leadership. And so when Carol came on board, I suggested that we talk about that. So she happily said she would love to partner with us. But primarily, back in 2014, the Florida legislature passed sweeping child welfare legislation. And so several of those components are a factor for educating our child welfare social workers. One of it was that they established preferences for the Department of Children and Families to hire social workers for their Child Protective Investigators, or CPIs. And then they also set a goal that the Department of Child Welfare, or Children and Families, hire 50%. That 50% of their workforce would be social workers. No, I'm sorry, not 50% of the workforce, that the CPIs right. would be social workers. Then that same legislation created the Florida Institute for Child Welfare with several mandates for us to accomplish, and one of them was to look at the child welfare workforce and their retention and how ways to reduce turnover. So we're in the third year of a 5-year longitudinal study of the child welfare case managers and CPIs, looking at individual characteristics as well as organizational influences on why they stay, why they leave, how quickly they leave, and all of that. And two of the biggest reasons so we have 1,000 workers in the study, in the sample, and two of the biggest reasons that are coming out of that for the reason they leave is, one, they feel ill-prepared to take on a caseload after training, which means they're not transitioning or translating that knowledge into independent casework. And then the other is the style and amount of supervision that they're getting from their supervisors. So I think we can look at that and see if we can't obtain some workshops that are research-based and practice-focused to help supervisors and social workers so we can build a better, more confident, more capable workforce with lower turnover. Mm-hmm. Mm-hmm. So goal of ours. Right. And I also want to add that we're the Casey Family Programs is also partnering with us on this and sponsoring the track.
Well, that sounds like a lofty goal. So has the Institute sponsored a similar track at another conference?
Yes, back in 2015, we began the work with the University of South Florida, who has been doing the Child and Adolescent and Adult Behavioral Health Conference. I think they're in the 32nd year this year. And the interim director at that time, same sort of thing, went to the conference and said, look, this is behavioral health. Why don't we have a child welfare track? Because behavioral health is so significant in our families that are involved in child welfare. So we started that work again with Casey Family Programs, and I think we're up to our 4th year now, and we're getting 30 and 40 workshop proposals. We're having to turn some people away, so it's really grown, and it has become a very popular track at that conference.
Wonderful. Carol, let's go back to you, and we're going to kind of switch gears here. So can you talk about how you see child welfare social workers fitting into the association?
Absolutely. So our association throughout Florida, so we have, in terms of social workers in general that are part of our organization, we have a group of child welfare social workers that are members of NASW, but there's so many social workers who are in child welfare who are not members of NASW. And part of that, maybe for the same reason that Marianna talked about, is not really feeling like there's something in it for them. And so this track is an effort to say, well, let's try and pay attention to this population because they definitely have needs for training. The research has shown that. We do have the staff there. So NASW really needs to strengthen their outreach and their provision of continuing education for child welfare social workers. So we're looking at this as possibly a way to bridge that gap so that social workers in child welfare really see NASW as their organization also.
Wonderful. And how do you expect that change to change the conference for the 2019 conference dates?
Well, the biggest thing is that we have a specialized track that we've been working on with the Institute for Child Welfare. And Marianna has been so instrumental in really pulling together the Institute, NASW, as well as Casey, and ensuring that we're having all of these collaborative conversations and planning. So I think when child welfare social workers and practitioners and people who work in child welfare will see the array of sessions that we're offering, I think they'll be very excited about it. The proposals that we're looking for, identify areas like looking at systems from a more of a macro perspective, leadership areas that we talked about. There's so many levels of child welfare that we want to look at. We want to look at specifically foster care and adoption, and what is some of the research around those areas. We have a lot of child welfare practitioners in the field, social workers and non-social workers, whose practice may not be informed by research, and they're looking for tools. And so I think we're going to be able to offer some of those tools that folks can actually attend the workshop and leave with something they can implement.
Perfect. And Marianna, can you just talk to us about what topics you might be soliciting from researchers for the 2019 conference?
Sure. And we had a big conversation around
Yes.
around this. And some of it's based on the research that the Institute has done, going back to the workforce studies. So we definitely want some proposals that address retention and supervision. Definitely looking at all three levels of supervision and organizational that Carol mentioned. But also, a lot of the attendees at this conference are licensed clinical social workers. And so a research project that we conducted a couple of years ago found that many of the clinicians that treat our families, those in child welfare, are not prepared to adequately address their multi-needs, their multi-generational clinical and behavioral health needs. And they're also not comfortable with interacting with the child welfare profession. And we've actually had a couple of studies that have found that we've funded. So we're looking at this as a really good opportunity to cross-train and to maybe build some collaborative efforts between the clinicians and child welfare workers so that they can look at strengthening those professional and provider competencies that address treatment goals, the practice model, service planning, conditions for return, and so that both the child welfare professional and the clinician are on the same page when they set goals and expectations for the families that they jointly serve. So I'm really hoping that we can get something along those lines. And I believe Casey Family Programs is looking to maybe even sponsor a plenary on that topic. So it's also the new Family Preservation Services Act is coming out, or has already come out. And so I think we hope to get some workshops from, what was it, the Child Legal Aid?
Oh, yeah.
Yeah, we might try and get a speaker from there to show how that is going to impact congregate care, how it's going to impact the providers, the clinicians. It's pretty big, massive legislation. And then, again, that joint, the clinicians and the child welfare professionals, what are the clinical implications of the practice model? And how that, again, ties into both areas. So I'm so excited.
When you were talking, Marianne, I was thinking about just the integration of child welfare and behavioral health. And it's so timely that we're having this track at the conference, because we're really having more of those conversations. We're looking at doing a lot more in-home services with our families instead of removal. And so having a workforce who is knowledgeable and skilled in some of the aspects of behavioral interventions and understanding even the assessments. So the cross conversations and practice between those licensed professionals and child welfare staff in understanding how to use some of those assessments that they're getting in terms of their case plans, how to integrate those things so that they aren't separate, but they're really fully integrated so that families are getting the most comprehensive kinds of intervention that we can provide. So I think it'll be some unique aspects of that when everyone is together in those workshops.
Well, this all sounds wonderful. When are proposals due for the NASW?
So we are seeking to get our proposals by November 30th. And so there is actually a website. So you can go on NASWFL.org. So that's NASW Florida website, and you will see the call for proposals there. And there is a separate flyer that we've developed that will be posted following this that will really identify some of the very specific things we're looking for our child welfare workshops.
And you can also go to the Institute's website, ficw.fsu.edu, and we have a banner on the call for proposals there for more information.
And the conference is June 13th through the 15th, 2019, and it will be in Orlando, Florida at the Florida Conference Hotel.
Thank you both so much.
Thank you.
Thank you.